It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks for joining us, folks. Hey, folks, I got great news for you. Okay, we have these health shows sponsored by Lehigh Valley Hospital, Hazleton. And I have to tell you about an interesting thing before I get to my guest here. A person came to us, my wife and I, when we were shopping, and just couldn't thank us enough for having these health shows. One of the shows we did, and I'm assuming it was Dr. Daniel Benyo, we discussed some things, and she told her sister to definitely watch the show. She watched the show. Her sister was reluctant to go to the doctor, et cetera, et cetera. She did. Luckily, she did, because we saved her life. And so that makes you feel good, and those are stories we hear all the time. So for those people that do not have cable, you should have cable. We have great news again. You download YouTube and just search SSP TV, and you can watch all of our shows, including this health show that we do that's sponsored by Lehigh Valley Hospital. And also our app, search SSP TV. It's all good information. Incidentally, if you have Hispanic friends, if they download YouTube, we now translate our shows into Spanish. My guest today is Dr. Jodi Lenko. Doctor, thanks for coming on the show.
Thank you very much for having me. It's a pleasure.
You have a great family.
I do.
I know your daddy, Dr. Walczynski, for many, many years.
Yes, my dad. Yeah.
He's one of the few great ones we have. Well, I'm saying many of the great ones we have in this area, but old school but new school.
Yeah, he's been here since 1977.
Yeah, I was born then. I think I was born in 1977. Don't be laughing, Tammy. Tell me about yourself.
So I was born and raised in the Hazleton area, born and raised in Drums, and did my some schooling out of the area for a while and moved back to Hazleton in 2011 after finishing my training, and I joined my dad in practice that year. And then a couple years later, we joined Lehigh Valley Physicians Group. So we've been practicing happily together ever since.
So when we see you, you say, "Who's that teenage girl?" You know, which is a compliment. Okay, yeah, but that's great. So I know your dad's a doctor. So was the influence why you decided to go into medicine?
Mostly, yeah. So he's been a physician here, like I said, since '77. He has had a family practice since that time. And I always grew up, exposed to healthcare and exposed to, the hospital. And I would make rounds with him as a child at both St. Joe's and Hazleton General when they were around. And then I just had a love for the sciences and the human body. So as I continued schooling, I pursued medicine. So did my brother, actually. He's a psychiatrist. And I was lucky enough to follow in my dad's footsteps. So that was what brought me back to Hazleton.
So you went in medical school. I always like to find out why you went into certain directions. Some people become specialists in either heart or cancer or whatever, okay? You're a primary care physician, okay?
Correct.
So this is what you wanted to do instead of, going into a specific category?
So it's tricky going through medical school. You're exposed to a lot of different areas. But for me, I liked being able to get to know families. So going into something where I had some longitudinal care and continuity with patients and their families was important to me. So that's similar to what my dad has always done, and I really valued those relationships that he developed over time. So that was one of the main reasons why I decided to go into my practice is general internal medicine, which basically is primary care for adult patients. I don't see, or I was not trained in seeing children or adolescents. So that's one of the reasons. And then there was a lifestyle choice too. I knew I wanted to have a family, and primary care lends well to having a little bit of a work-life balance, which is very important to me. As I have two small children, their ages 4 and 6, two little girls, who are also equally as much, or if not more important than my work. And that was a big driving force in why I wanted to go into primary care. At least it gives the patient some trust that I'm from the area, I know this place. I've worked here for a few years now and have had established relationships with a lot of these people for many years. We have a lot of specialty services that are right here, full-time services, cardiology, endocrinology. A lot of our surgical services are right here, and they're excellent. My own parents go to our local physicians as well, and I use our own, pediatrics department here for my children. And they're excellent services, and I don't think for the majority of cases you need to go out of the area to seek care. Now that's where we're lucky because we have a great relationship with Lehigh Valley, Cedar Crest, Muhlenberg, and now Pocono that all have additional services that We just don't have the population to support.
Sure. Going to a doctor and they say get a second opinion. Well, in some cases, they're getting more than a second opinion because you're referring to many doctors, okay, about that particular case. Am I correct in saying that?
Yeah, absolutely. So there's a lot of times that we, either consult with, even before a patient we refer a patient somewhere, we consult with a bunch of physicians or a group of physicians before we even decide where they need to go. So that is, and that's a benefit that we have now with Lehigh Valley Hospital in Allentown, that they have those extra services available to us as physicians that we can reach out to other specialists before even making the decision to refer somebody on.
For the sake of our audience, okay, what is internal medicine?
So internal medicine is basically the general medical care of adult patients. So if you were going to a general internist, all patients that we see are over 18. For any primary care need, whether it's taking care of your high blood pressure, your diabetes, your routine physical exams, your colds, your aches and sprains that you develop, that's what we do almost all the time. So 80% of my time is now working in the office, and I do have a little bit of an administrative role now too as part of the Lehigh Valley Physicians Group, that I handle some of the administrative duties as well.
So you said 18 and over. Mm-hmm. Okay. All right. So there are many people, that go once a year. I do for a physical. I go to Phil Benio, and he does the blood work and does all of the stuff, and I go for my PSA test and the whole bit. I hate it, but I do it. Okay. For those people, there are many people who just, I don't need a doctor. Okay, etc. How do you get them convinced to get a yearly checkup? I think that's so critical, don't you think?
It's absolutely critical, and there's a lot of research out there that preventative health care is as important to the health of our society. So there are a lot of things that you can do. One, to look for problems such as colonoscopies and things like that you won't know you have a problem unless you do a colonoscopy. And there are pretty specific guidelines as you get older about how often you need to go for one, who needs to go for one. And that's what you need to talk to your primary care physician about. And then there's other things just that we can suggest to help make you healthier, whether it's quitting smoking, whether it's improving your exercise, improving your diet, just some simple things that you can do in your life to prevent injuries and just overall extend your lifespan. So there's lots of different reasons, and we are not all about pushing medications. It's a lot about things that you can do for yourself to help prevent problems as opposed to waiting for the problems to happen.
I know of cases, Jodi, that people felt great. I mean, they had nothing wrong with them. They didn't think they had anything wrong with them, and all right, I'll go for a physical. And so they went, and the doctor found a couple things, that could go into something serious. Okay, sure. It's like colon cancer, where I would think, I waited 3 years before I went for mine because I'm a big baby. Okay. Well, when I went up, there was Dr. Miller did mine, was a piece of cake. I mean, I highly recommend, at least going whatever the doctor recommends. But they went and they felt good. I mean, they felt actually great. And then they went and the doctor says, I want to look at this a little bit, and found some things that, thank God they found them, because they develop into something else, okay? I'm sure you've seen these kind of cases.
Yeah, unfortunately we see it, more often than we'd like. We'd rather, not find any problems. Our goal is to just give you the clean bill of health, but sometimes there are things that we find, whether it's a lab value that just doesn't seem right, that we have to do some more research on, or we just recommend the regular cancer screening. I had a patient myself that was very scared to do a colonoscopy. So there's another test that you can do that's a special stool test that tests a piece of your stool. And she told me she would absolutely do the colonoscopy if that test was abnormal. Well, it turned out that test was abnormal. She went on to have a colonoscopy and had a precancerous lesion removed. So it's just some simple things that people can, even though you are maybe afraid, just talk to your primary care provider about it.
Well, I'll tell you, again, when I walk into a dentist office, my blood pressure goes up, okay? So I use myself as an example. When you go for a test, okay, everyone's always, what if they find something? What if he finds something or she finds something? Well, you don't want them to find any, but maybe they should if there's something wrong, okay? Right. When you say internal medicine, you're saying 18 plus. Why is it the 18 and not, if I want to bring my 16-year-old kid or 15, okay,
It mostly has to do with how the training starts. So in medical school training, internal medicine training starts at 18 and above, only because then from there on, a lot of, to become a specialist, say in cardiology or gastroenterology or something else, you have to do the internal medicine training first. So all gastrointestinal doctors are also trained in internal medicine first. So I think that's where the division comes from, 18 and above, because all of the specialists will only see patients 18 and above, as opposed to below that, which is based on pediatrics training. So we were in internal medicine training, you don't get any exposure, any training to children. It starts at 18 and above specifically for that reason. It focuses a little bit more on the specialty care, the endocrinology, the diabetes, the cardiac, the heart health conditions, things like that. But that's where the division usually happens based on the medical school training and the residency training.
We come back, we're going to talk about the specialist. We talk about there's many specialists we have in town and how they work with Lehigh Valley, the entire network, which is fantastic. We'll see you right after this break. Welcome back to the Sam Lesante Show, folks. Remember, 24/7. You can watch all of our shows on ssptv.com. Our app, search SSP-TV. All of the shows are there, especially all of our health shows are there. And for those of you who know friends that do not have cable, which I think you should, if they have satellite or DirecTV or the dish, all they have to do is download YouTube, search SSP-TV. They can watch all of our shows because I know many people say they don't get the show. I always try to tell them that cable is a great opportunity for them, but you can now watch us. We're talking to Dr. Jodi Lenko, who is in internal medicine. Who do we have? And what?
So within Hazleton, we have a variety of subspecialists, whether it's within the internal medicine or the medicine specialties. So those would include physicians like your heart doctor, your cardiologist. We have 4 fantastic cardiologists that spend all of their time here in Hazleton. And we also have a part-time endocrinologist. We do have 1 neurologist as well as a nurse practitioner that works with him. And we also have 2 fantastic GI physicians that are employed by LVPG. And then there's, among others, we also have some surgical, lots of surgical options as well, and OBGYN. Outside of that, we are somewhat limited in terms, I forgot to mention hematology, oncology, of course, Dr. Evans and Dr. Hotchner.
2 great guys.
Yes, fantastic.
2 fabulous people.
Yeah, and then we have some other support with them with a lot of these services as well. We call them advanced practitioners or physician's assistants and nurse practitioners. But we're somewhat limited. It's we have a lot of these services, but sometimes it gets either that we don't quite have enough of the providers here, such as with endocrinology, where we only have a part-time person. She comes once a week, Dr. Potter from the VA. And there's a lot of endocrinology problems that we run into on a regular basis that we, as primary care physicians, need some extra assistance and some extra specialty care. And that's what Allentown has been supportive in doing with us, is providing some additional support with physicians from Allentown to come up on a once a week, once a month basis to help support the needs of the community.
The general public, I don't think, sometimes have a real good handle on all of the communications that you're doing with respective doctors or, in Lehigh Valley, and particularly working with a particular patient, okay, especially if it's a serious matter. That system, okay, that you're talking about, particularly if you have a urologist or whatever, how does, behind the scenes, which the average person, you don't come out and say to the family, well, this is what I did this, I did this, I did. In some cases, you can say we have this person working on it, but there's a lot of interaction going on. Am I correct?
Yes, and it depends on, it's a case-by-case basis, and there's a more interaction with the providers and the physicians within the hospital setting, I would say, because the things are changing rapidly with your patients. So things are, and you need to be making decisions more quickly. When it's in the office-based setting, those things happen on a little bit more slowly. But we do communicate by a variety of mechanisms.
Oh, yeah.
email is one of them. So we are all linked in with the same email, and I use that a lot to help facilitate some of the care between our patients. Also, we have an app on our phone that's almost like it's a secure text message that we can message any provider within Lehigh Valley Health Network, and it's HIPAA compliant, so none of the patient information it's a secure network, so we can converse back and forth between that. And then there's always just the electronic health record. So we share information with the electronic health record, whether it's through your blood work or your imaging tests that you've had done, or just the notes going back and forth after the physician sees you in Allentown. They send the note back up to us, and we review the note to either explain what they did or just complete what, and supplement the care that they've already had from whether it's Allentown or Pocono or wherever, or here in Hazleton.
Do you ever use the telemedicine?
Yes.
Yeah.
So we use it all the time in the hospital. We're a little bit limited right now in the office-based setting.
Explain to our audience what telemedicine is.
So telemedicine is a service that basically is what we're doing right now. It's like a physician would be providing care to you in your living room by a video camera through the computer, and it's a two-way conversation, so we can talk back and forth. Think of Skype, basically, or video chatting is basically how to think about it. A little bit more advanced than that. So we use those services in the hospital for services like infectious disease, where we're dealing with complicated infections. We don't have, in Hazleton, there are no infectious disease physicians that are in Hazleton at all. So we use that service in the hospital to deal with these complicated infections, and we use the subspecialists in Allentown through this computer to see patients, and we are very grateful for those services, because they provide a tremendous amount of information and additional support for us in Hazleton that we otherwise would not have. We use it for infectious disease, for the ICU. They actually have cameras in the intensive care unit in Lehigh Valley Hazleton that are constantly monitoring the patient and their vital signs. And then we also use it for neurology. Since Dr. Chickermani, as many of you probably remember, retired, we've been a little bit limited in the hospital with our neurology services. So when a patient has a seizure or is showing some signs of any neurologic problem, whether it's a muscle problem or something along those lines in the hospital, we use the neurologist through the telemedicine as well. So that's something that's been a robust service for the past few years, and we've really been utilizing that service through Allentown.
How fantastic that is. When you think of it, no matter where that specialist is, it's like the robotic surgery. Mm-hmm. We did this show with the new robotic surgery up there. I mean, it's fascinating. But at one particular time, I don't know if they're able to do this yet because it's robotic, and you have a specialist in Australia or Japan or whatever. From what I understand, that particular doctor can do the surgery from where it is on the robot. Yes. I mean, this is phenomenal, isn't it?
Technology is fascinating, yeah. So we're trying to incorporate as much as we can to enhance the care that we can provide in Hazleton, because there are certain things that we are always going to have some limitations because of our geography, just being in Hazleton. So that's where Lehigh Valley has really stepped up, and where we can't do telemedicine services, that's where they've started to do provide additional support with some of these other services that we're going to talk about today, where they're bringing physical physicians up here to help support our community.
I'm talking to Dr. Jodi Lenko. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. This show is brought to you by Lehigh Valley, the Lehigh Valley Health Network in Hazleton. My guest is Dr. Jodi Lenko. Now, let me explain some things for you. If you'd like an appointment with this wonderful person here, Dr. Lenko, you're going to call 570-5014-LVHN. Now, we're going to talk about specialists, and we're going to put the phone number. What's changed? I had said 401-CARE, it is different. It's 888-402-LVHN. So let's talk about the specialists. We've got about 2 minutes left.
Okay, so the specialists that we've recently started, and with the great support of Allentown, so we've had some fantastic physicians start to provide some care in the Health and Wellness Center. So it's local. The physicians literally travel all the way up from Allentown, sometimes farther, and they're coming about once every 2 weeks to once a month, sometimes once a week, to provide some of these services. Right now, the services that we have, endocrinology, so advanced care for your diabetes, some other problems such as parathyroid problems, hormonal issues, things like that. We have an endocrinologist that is now coming up regularly. In addition, one of the best ones that I've had a lot of success with is rheumatology.
Yes.
So patients with lupus, rheumatoid arthritis, psoriasis, all those fancy medications that you see online or on advertised now. So we now have a rheumatologist that is coming up regularly. We also have another neurologist, even though we already have a neurologist here in town. To supplement that, we have another neurologist coming up. And finally, I'm missing one, I believe. Endocrinology, pulmonologist. So your patients with bad COPD, bad lung disease, you find a lung nodule, all these special situations, we have had some great support from pulmonology as well. The other a couple other services that we will in the future start having is infectious disease. We talked a little bit about that already in the hospital. We're going to have some follow-up support with infectious disease physicians in the outpatient setting as well, whether that's to do with these fancy infections, HIV, and then a separate service is hepatitis. So there's unfortunately a pretty pronounced population with hepatitis C, and we have some physicians coming up specifically for those treatments.
Well, it's so nice having you on the show, Jodi.
Thanks for having
Folks, she looks like she's 18, 19, but believe me, she has a lot of experience, 2 wonderful kids, and your husband.
Yep, my husband couldn't do it without him too.
Yeah. Remember, if you want to talk to this girl, it is 570-501-4LVH. And also for if you want the specialists, 888-402-LVHN. Did I get the phone numbers correct?
I think so.
All right, we'll see you next time.